Hi, this is Dr. Laura Larson. I'm going to go ahead and get our meeting today of the Carroll County Board of Health started. Do we need to go ahead and have people who are on the call mentioned who's here, or would somebody like to do a count or a discussion of who's on the call currently?
Dr. Larson, this is Debbie. I'll call out who I've got, and anyone else, I don't call your names if you'll let me know. I've got Ms. Kaysen and her attorney, Stacy and Avery, an EMA representative, Loy Howard, Catherine Graham, Cindy Barge, Laura Larson, Chuck and Betty. Could I have a last name?
You had us right at the beginning. It's Betty Kaysen and Chuck Connerly.
Okay. All right. Thank you. You've also got Dr. Obasanjo, Frida Mitchum, Amy Finn, Seth Woodrow, Barbara Stevens, and Wendy Levan from the district office.
Hey, Debbie. This is Ashton Harris, epidemiologist.
Thank you, Ashton.
Okay, Michelle
And
Morgan.
Ryan Jones.
Oh, go ahead.
Ryan Jones.
Director.
Ms.
Michelle Morgan. Yes.
Michelle Morgan?
Yes.
Thank you. Anyone else? I've got it, Dr. Larson.
Okay, great. We've got a lot to talk about today, so I'm going to try to keep this organized. I'd like to update everyone on the current status of our concern in Carroll County. About 2 weeks ago, we started noticing persons matching the probable description of COVID-19 cases, and we started testing. And unfortunately, a lot of people started testing at the same time, and the lab we were using essentially became bottlenecked, and we did not have results. And even now, 2 weeks later, we don't have some of those results available to us. The hospital system discussed this, and we went to a company with a faster turnaround time, which we started using on Tuesday, and then our first positive tests were confirmed 2 days later. And after 3 days of testing, we have 36 positive tests from our hospital system, 28 of which are Carroll County people. So given that information, we really think we probably have had a transmission of COVID-19 in Carroll County for weeks. We just weren't aware of it, and no one was testing potentially early enough. And even if you were testing early enough, those test results are still pending in some cases. So you've heard a lot of information about flattening the curve, and the difficulty with that is how does that relate to Georgia, and how does that relate to Carroll County? There is some new modeling that suggests that the point of no return for Georgia is estimated to begin on March 24th. And after that day, every day we delay restrictive measures, we run the risk of a earlier and higher peak to infected Georgians, and I think it will completely overwhelm our hospital system if it gets to that point. We know what's happening in Italy now, and watching those numbers and seeing those reports and hearing what people are dealing with is very disheartening and scary. So we know that we're months away from the vaccine. We're months away from any approved FDA treatment. We cannot ensure adequate hospital and ventilator capacity throughout the system if we use modeling. We feel as a state we will likely not have enough capacity and ventilators to take care of everyone who might need them.
And I'd have no idea why.
At this time, I think that the safest thing that we can do for our citizens is to restrict more of what we do. And if we do nothing right now, there's a lot of information about there. We can estimate how infectious COVID-19 is versus influenza. And if we do nothing right now, the estimates are that one infected person infects 2.5 persons in 5 days, and ultimately that will be 406 infected persons in 30 days. If we restrict half of the exposure, one person will go on to infect 15 people in 30 days. And if we have 75% less social exposure, that one person that originally infected 406 persons in 30 days would only infect 1.5 persons in 30 days. I think we all understand and are sensitive to the real concerns to the business community and the economic impact that a state has on mandating social distancing, and the community mandating social distancing. But I think the problem is if we don't do this, the ultimate problem and impact to businesses will be far greater, with a far percentage of person being sick and a longer period of time that people will not be able to work as usual. So that's where I wanted to start. I want to talk a little bit about specifically Carroll County. Obviously, on our side, from the hospital side, we can see who people are. We can talk to people who are infected. And we have been able to identify clusters of infection, and one cluster is large enough that I feel very strongly we should limit our congregations of people to 10 people or less. I have read what the city passed today, and I feel really strongly that the county needs to follow a similar recommendation to protect people from getting sick. And I'm going to stop there, and I wanted to ask the board members to ask me any questions if you have any at this time about this.
Dr. Larson, this is Chuck Connerly. One of the things that we have been getting since we had our meeting this morning is all of the elected officials and the folks of the city are getting inundated with requests to disclose the hotspot. And also there's just rampant rumor and speculation on, social media, most of which is incorrect. But, and I don't know if this is the time in the meeting for it or if this is something you want to hold off on to discuss till later, but from the city standpoint, one thing we'd like to know is what can we share with people? What should we share with people? And on a related topic, would it be something for the Department of Public Health to issue a statement about that? And what's the right way to handle that?
Yeah, I'm getting the same requests and opinions because on one hand, we know that certain situations that there may be ongoing transmission if people keep going back to the same places that are an area of concern, and that's why we're talking about this today, because by doing what we're doing, we wouldn't necessarily have to disclose specifics if we're able to pass the things that we need to pass, because those events could no longer happen. Those places that people are going would no longer be able to have the same exposure. But at the same time, I know, you can read in the newspaper specific evidence and online of areas of hotspots that have been disclosed. I think that it's very devastating to some of those, to some of those entities for that information to be disclosed. So I kind of see both sides. And Dr. Obasanjo, do you have any guidance on what public health is allowed to do?
Well, public health, we're not allowed to disclose personal or identifiable information. So when people ask me about this, I use the STD model when we do our contact tracing or epi investigation. If people came to me, for example, and told me, which is our standard, or you are a contact of an STD case, they will not tell me who that case is. I can speculate all I want, but part of our protocol is I will not be told who that case is. And that's the same standard we're using. So having said that, some even hospitals have identified individuals on contacts, understanding their HIPAA responsibilities, and I'm assuming they had taken care of that by either, by doing everything they needed to do under HIPAA before making that identification. The political entities, counties, cities don't have the kind of HIPAA responsibilities we have, but even though you don't, you're identifying or you're identifying people or places would jeopardize or could jeopardize our activities in public health. So it's a delicate balance. But having said that, just like Dr. Larson said, a lot of the things we're putting out now, like the resolution that the city puts out and that Dr. Larson is recommending for the county, and the recommendations that we as public health are putting out to the community without identifying anybody, if those are just enforced generally, then that should suffice.
The other comment I want to make about that as well is even if the public knew the places that would be potential areas of concern, there are cases all over the county. It's a false sense of security to say, oh, I'm not going to go to this place or that place because we are identifying very, very few areas of concern, but I still have 36 positive tests, of which only about 10 are an area of concern. So I have 26 other positive tests that I can't identify an epidemiological connection. And if we look at the locations of where these people live, it's all over the county. So I really don't think that disclosing specifics will protect our community.
This is Chuck again. This is what I've advised the city to say, and this is what I have said, and that is that we're not disclosing the location or the name of the hotspot at the recommendation of the local board of public health, and that if people need to be contacted because they may have been exposed at that hotspot, that is something that local health officials are doing. Have I overstated that, or is that an accurate statement, and is that a good response?
That's 100% accurate.
And y'all's recommendation would be, I assume, to just continue to say that.
Yes.
Okay. All right. Fair enough.
Yes, sir. Yes, sir.
Dr. Obasanjo, one of the questions that I've gotten from people in the community is how quickly are you able to start the contact investigations from a Department of Public Health standpoint? And I want to tag on that, with many of these patients being hospitalized, can we help you do some of that contact investigation, or is that completely outside of our role in healthcare? We just want to help in any way that we can, and we have a lot of people that are having to readjust their jobs at the hospital that we're having to very much streamline the way we do things in the hospital, and some people are not. There's a lot of people who want to help and who have time to help right now.
Ashton, I'm going to let you answer that, and talk to how we do our contact investigation, including timing.
Okay. So I'm Ashton. I'm the district epidemiologist. So as soon as we are notified of a positive case, what I do is I confirm with the facility, especially because we've been getting a lot of commercial labs, and I like to lay eyes on the lab before we start with the whole contact tracing. And from that point, the positive individual is contacted. They're informed of their positive status, and then we go from there to assess their close contacts. So very close household contacts, and we use the date of symptom onset as kind of a timeline to assess exposures. And then from there, depending on the risk, we enroll them in active monitoring with public health if they are high-risk individuals. But that is going to change as we're getting more and more positives. We are looking at moving toward just notifying the positive individual, letting them contact their close contacts, let them know of the situation, what to look for, the development of symptoms over the next 14 days. And then we're really focusing on healthcare facilities, healthcare workers, first responders, and long-term care facilities, and also clusters and outbreaks that we're starting to see.
So to answer to get to the second question, Dr. Larson, we do use, and I know in other hospitals we have been essentially partnering with those facilities to do the contact investigation and monitoring. Tomorrow, now that we have this cluster between Aston, Dr. Aguinaldo, who's a preventive medicine resident working with us, and Amy McCauley, we will get one of the three epi team members, leaders, to come to Tanner and sit down and essentially create that template of this partnership moving forward. So the short answer to your second question is yes.
Okay. Mr. Howard, is that okay from your standpoint? Okay.
Absolutely.
Okay. I just feel like we could help. And does anyone else have any questions about that topic with disclosure or comments? Do I need to recommend we vote whether or not we do this, or we just agree that we will plan to understand that the measures that well, let me do this. I think that as a chairman of Board of Health, I think that I'm supposed to essentially put forth a motion that we accept has anyone had a chance to look at the resolution for the county by email? From the city, there's also a county resolution that has been suggested. Is that right, Stacy, that I have the city's information that was passed this morning?
Yes, we took the city resolution and modified it to be proposed order for the Carroll County Board of Health that was emailed right before this meeting, and with a red line showing the changes. And it says that it's not intended to override certain provisions of the cities, like their specific alcohol ordinances. That's not within the Board of Health's purview, so that's left to the cities or the governing authority. But it's essentially the same protective steps that the city adopted this morning.
Dr. Larson, do you need that as a motion, or can I second your motion to approve?
Am I allowed to make a motion, Mr. Chairman? I've never even asked that question in so many years I've done this. I've always had somebody else do it. So
and I'm happy to make a motion, Dr. Larson.
Okay.
And who's making the motion?
Lloyd Howard.
Lloyd Howard.
Howard, thank you.
This is Betty Cason. I'll second the motion.
Are there any opposed to the motion?
Ask for any discussion.
Is there any discussion before we move on with the vote? So anyone opposed? And all in favor, say aye.
Aye.
Aye. Okay, that motion's approved.
But now, we may want to do a roll call, Dr. Larson, since we're on a video, an audio conference. It might be good if Debbie does a roll call.
That's perfect.
Saying yes or no, so we can make sure we record the votes properly.
Sure, that sounds perfect.
Okay, the board members,
go ahead.
the board members in attendance is Ms. Cason, Mr. Howard, Ms. Graham, Ms. Barge, Dr. Larson.
Excuse me, can you?
One at a time, I think she wants.
Yes.
Okay.
We'll call out the names.
Ms. Cason,
Yes.
Mr. Howard,
Yes.
Ms. Grahams,
Yes.
Ms. Barge,
Yes.
Dr. Larson,
Yes.
Ms. Morgan,
Yes. I'm on mute.
Took you off mute.
Yes.
that's all 7 board members,
All ayes.
Okay.
all ayes.
Yeah.
Thank you.
Mr. Howard, did you want to discuss a motion for the board?
Yes, thank you, Dr. Larson. In our efforts to secure adequate ventilators, so as we prepare for the surge at Tanner Health System, we identified 2 ventilators that we donated to the Tanner School of Nursing. When we were attempting to secure those ventilators, we were notified by university officials that the control of those ventilators were in transition to the state of Georgia. We very much need the ventilator capacity. We have a limited number, and 2 more will make a difference in potential patient surge. I'll certainly defer to Dr. Larson to discuss that in more detail. So I am asking for an order from this group to be approved to order the University of West Georgia to turn those ventilators over to Tanner so they can be included in our inventory.
Is there any
Mr.
discussion or
Howard,
questions? Go ahead.
Mr. Howard, I have a quick question about that. So the state of Georgia, and they're going through us, has requisitioned those ventilators from University of West Georgia.
Are you asking me that or telling me that?
I'm asking, sir.
Yes. No, I mean, I'm serious. I was just trying to understand. Well, they said that the state of Georgia, GEMA, they have been told by the Board of Regents that those are no longer theirs. We've had an outpouring from the community of support. People coming in from industry, from chicken farmers bringing us masks, and it's been wonderful. When we asked for these from the University of West Georgia, they said, well, we don't control them anymore. And they're sitting in the School of Nursing. And we're very familiar with them because we donated them.
Right.
And so we're being told, but the local folks are supportive, but they're saying that an order from this district public health will be what they need to be able to turn them over to us. Am I answering your question?
Yes, sir. If you don't mind, if you let me do some work on that. I think the board should vote to ask me to work on it, and if for some reason I can't, then make the request to the state. But we are in terms of ventilators and other equipment, we are the ones working on the inventory. So. If it's already here in Carroll County, they're probably going to turn it over to you anyway. But if you give me Monday, I think I should be able to work out those details and actually find out what they're planning to do with it. And if they were planning to give it to you anyway, I'll give it back to you. Just have them go ahead and do that.
Okay. And you can appreciate my concern. We didn't want them to slip through our fingers. As our objective is to take care of Carroll County, so that's why we're so aggressive. But I think that's fine. I appreciate it. I think I'm Dr. Larson, I'm comfortable with that approach.
Okay.
So Ryan, IP director, is on the call. He and I, he's on top of the inventory. So we'll mark it down and we'll get to the bottom of it tomorrow, and then I'll get back in touch with Dr. Larson.
Okay, thank you. I think I don't want to take any more time. I just think that the thing that just set us aback a little bit is that we've had other agencies say, absolutely, what do you need? And so that's what gave us some concern. Okay, thank you.
Yes, sir.
Are there any more items that the board members want to discuss or any other comments from this meeting?
Dr. Larson, one other thing I wanted to mention real quick. I know you and I have been emailing and texting back and forth, but one of the emails you had sent me was from Ms. Blackman about the powers of the Board of Health to implement public health control measures, and the fact that it is delegated to me through, but permission has to come from the commissioner. The commissioner has given permission, and what I will be doing tomorrow is to get the documentation of that for you and for all the other boards of health councils, so that you can have it on record. But she has given delegated those powers to the district health directors.
Okay. Any discussion about that today?
Well, this is Betty Cason. Are y'all going to give us some direction on how we need to proceed as far as our cities or, go, our residents? We're having tons and tons of questions. As Chuck alluded to earlier, we just need direction from y'all. I know we've got the 10-person rule, but is there going to be more specific things that we need to do in trying to help y'all control this?
Well, I think the resolution that's coming from the county and what the city did yesterday is pretty. For now, is pretty much using current knowledge and using science and using data to kind of guide what the counties and cities should be doing. As we get more information, we will be sharing. We will definitely be sharing with you. And I think in our case in Carroll County, we have probably, I think, the biggest asset in Dr. Larson, because she's right there with us in terms of our public health knowledge. So I think if anything additional needs to be done, or not, either we'll, again, through Dr. Larson, set up another board of health meeting if necessary, share with the county and the city, whatever needs to be done.
Okay. Thank you, Doctor. I'm the mayor of the city of Carrollton, just so you know. We're just getting inundated with lots of calls and, really specifics, and then they get frustrated with us when we give them the 10-person rule and 6 feet rule. I mean, so and I know it's frustrating for everyone to try to deal with the unknown, but we appreciate what y'all are doing. We really do. And Dr. Larson has just been awesome, and we're so thankful to have her here.
Thank you.
Can I make just a comment there to the mayor and then just also just to the whole group? I will tell you there are a group of healthcare leaders, if I may mention this. There's a number of us that are coming together to ask the governor to take more aggressive action. We think he's done a wonderful job so far, but we just think that we are either behind the curve or days away from being behind the curve. So I just want you to know there are a lot of efforts underway this is mainly coming from hospitals, to ask the governor to be for us to be more, for the state of Georgia to be more aggressive.
And to that discussion as well, Mr. Howard, this is Dr. Larson, and I'm a member of the Infectious Diseases Society of Georgia. Probably the preeminent infectious diseases doctor in Georgia at handling pandemics and the Ebola crisis is Carlos Del Rio, and he has drafted a letter to the governor as well that was unanimously approved by the Infectious Diseases Society of Georgia to take far more aggressive measures for our state to protect our citizens.
Well, Loy, I just appreciate y'all taking that, and also Dr. Larson taking that, because I just feel like there's still so many people out there that are just not heeding what we say. And, you know, we had the question this morning, is it because it's not getting out to people, or is it because they just don't realize how serious it is? One thing we're going to do within the city, we've had some, pastors that have made themselves available in their churches to try to get the word out to people, and we're hoping to use that. And then, of course, we've used our social media. But I think, just trying to get the word out to everybody, how serious it really is. And I think it's going to have to come from the governor.
I get that every single day. We usually somebody reaching out about why is this real? And there are just some people that, because it hasn't hit us hard yet in Georgia, but that if we keep going the way that we're going, it will. And I just encourage them to read everything they can about what's happening in Italy right now. And I'm surprised when those people contact me back and say, I didn't realize that could happen here. The Italian healthcare system is a good healthcare system. So the countries that have successfully overcome this pandemic are the ones that acted rapidly at shutting everything down. And so it's uncomfortable for us to feel like that has to happen to stop it, but that's really the only, as our, the Dr. Del Rio, his letter said that right now social distancing is the only vaccine we have to stop the pandemic. And I thought that was a really strong statement. So that's how we have to look at it.
And I would just like to reiterate the point that's already made. We are so blessed to have Dr. Larson and someone with her ability leading our fight in this region.
I appreciate all of that, but we've got a fantastic hospital system, and I'm terribly proud of how, we keep telling each other, if there's any good thing to come out of this, it's that leaders in the hospital system have just stepped up to the plate, and it's collaborative, and we're working, and we really feel like we have a handle on what's going on right now, and so that's where we want to be. We just need people to stop getting around other people so that we can handle the amount of illness that we can take right now.
So Dr. Larson, to come back to the ventilators, my instruction is to find out what exactly is happening to the ventilators, report back to you, and then based on whatever I report back to you, the board will instruct us to write a letter? Or is that what you wanted, Mr. Howard?
Yes, we just need it Monday. We just need it. Again, I'm trying to protect the interests of our community. And I hope this comes out right. We just don't want it to go to Atlanta. We need those ventilators here. They are here at the School of Nursing. And so the time is of the essence. But yes, that would be great. And so we can deliver it to the university.
And one of the, ventilators are one of the main pieces of medical equipment that we're all worried about. If you look at the numbers in New York right now, they're recommending that hospitals increase their capacity to handle 100% of what they're handling now. And even surging what we have now, would not be 100% without those ventilators. And so that's why I think it's really important. My question for Dr. Obasanjo is, do you need us to vote as a board today if those for approval that we would recommend as a board that we get those ventilators if they're in question, along with your letter?
I don't know. I don't know because I don't know where it is and what's been ordered or what I would do. What I would like is something where if I come back to you, Dr. Larson, and there is some action that's needed from the board, there is no delay of us trying to get permission from the board. The board's already given us permission to take that action. Write a letter, go see call the gov, whatever we need to do. We already have permission to do that.
May I suggest that the Board of Health go ahead and adopt a resolution directing Dr. O to take all action necessary to obtain the return of those ventilators, and then he can use his best efforts to do so.
Dr. O, you okay with that? If I
Yes.
make that motion, I'd like to make that motion, please.
This is Betty Case, and I will second that motion.
And to make this easier, is there any more discussion about this before we vote?
Hi, everyone. This is Ryan Jones. I'm the EP Director for District 4 Public Health. Just because I know I'm going to be part of tracking this down, can anyone give me information on specifically which school of nursing and the location and also the type of vents that are out there?
Well, I do not know the type of vent they are. I just know that that would be Deborah Matthews, our Director of Nursing, can tell you. She's familiar with them. But they have been sourced and actually been, we've confirmed their location at the Tanner School of Nursing on the University of West Georgia's campus in Carrollton.
Okay, great. Thank you.
If you want me to get you type of ventilator, I'll have to research that.
Yeah, Mr. Howard, if you can, yeah, that would be helpful. As much information as you can share with us, including Ms. Matthews' contacts, whatever information or contacts you can share with us.
Okay, I'll get on that.
Yeah, Lloyd, this is Catherine Grams. You're sure the ventilators are still in the school?
Yes, we got confirmation about a couple hours ago that they were.
Okay.
But, so.
And Dr. O, I'll get him on that immediately after this call.
All right, thank you.
And can we take a roll call vote again?
Yeah, that'd be perfect.
Ms. Cason?
Yes.
Mr. Howard?
Yes.
Ms. Graham?
Yes.
Ms. Barge?
Yes.
Dr. Larson?
Yes.
Ms. Morgan?
Yes.
Thank you.
Okay. Are there any other items that we want to discuss today?
Hey, this is Cindy Barge. I wanted to ask a question. As a physician's office, we are staying open. I know there's been a lot of offices that have closed, but we feel an obligation to our patients in the community to try to treat these patients that need to be seen and prevent them from inundating the ER with sinus problems, things like that. We are sending our patients to the Tanner drive-through that we feel like need to be tested and trying to prevent anybody that's been exposed in our clinic. The question that I have, of course, is receiving supplies like masks for our employees. We do have some, but we are running low. We do have a few N95s, but just even the surgical masks, we're running low. We did, of course, make a
we did send in the form to the state, but of course, being a physician's office, we were denied. Does anybody have any suggestions on what we can do, for the employees?
Cindy, what you want to do is reuse and extend use of what you're wearing.
Okay,
right
and we
now-
have been doing that, on a daily basis, but we're still running a little bit low.
That's the strongest measure you can do right now is to extend and reuse what you're wearing. You know, we're trying to source any options we have as well for the hospital. And even if you talk to suppliers and vendors and things like that, most of the suppliers that if I try to go online and buy a mask right now, I'm not going to get it until May.
Right.
That's not timely at all. But I would encourage you to touch base with us at the hospital. We're trying, obviously, to conserve our supplies because we're all in the same situation. The other thing that I would encourage you to do as much as possible is to enroll your office in telemedicine opportunities.
Yes,
Because a lot of things can be done over the phone without physically having to see patients, but that can't happen in every situation as well. But if you can do that, another thing that I would do is recommend limiting your mask usage to the person actually seeing the patient and then social distancing yourselves in the office. So if you can try to conserve that way that not everyone in the office either needs to be there or needs to wear a mask in one way of conserving. We've done the same measures in the hospital. The only people wearing masks are in patient care areas, or that for the most part, unless they have other risks. So those kind of things are what we're trying to do on our hospital side, because we're all facing the same problem right now.
Yes. Okay, thank you, because we are doing the telehealth and we are trying to do all of that. Thank you very much.
Sure. Thank you, Cindy. Any other items up for discussion? Okay, Debbie, you've got to tell me if I need to make a motion to end the meeting.
If you don't mind.
Okay, I always think that's weird, but I'm going to do it. I'm going to make a motion to conclude our meeting at this time.
Move, thank you. Seconded.
Thank you.
Okay. Any discussion about that? And Debbie, if you want to do a roll call.
Okay. Ms. Cason?
Yes.
Roy Howard?
Yes.
Ms. Graham?
Yes.
Ms. Barge?
Yes.
Dr. Larson?
Yes.
And Ms. Moore?
Yes.
Thank you.
Okay.